Thanks everyone. So today we're really grateful so far for the support of all of the community in regards to the testing response that's occurred in Shepparton. We've so far since the outbreak began in... All right.
You keep going.
Yeah, so far since the outbreak began since Friday, we've tested over 14,500 people. Unfortunately, that's not quite enough of where we would like to be just at this stage. We are still detecting positive cases of people with COVID-19 in the community. So since the number of cases was announced overnight and this morning, there has been more positive results, a handful more of positive results that we've received today. So we're really asking the community that for people who have not been tested, from the exposure sites that are listed so far at the Boucher Street Primary School, St Mel's Primary School, Notre Dame College, all sites of Notre Dame College, also all campuses of the Greater Shepparton Secondary College and Orvale Primary School and Mooroopna Primary School. So people from those locations, if we know they're already exposure sites, if you haven't come forward and been tested and you have been to one of those sites, please come forward and be tested straight away. The other thing is, as I said before, we're still seeing people that are testing positive now for COVID-19 that aren't necessarily linked to those sites. So again, anyone who has the most mildest symptoms of COVID-19, we want you to come forward and be tested straight away. So don't delay that, don't put it off. There's plenty of access to testing capacity right across Shepparton and into Mooroopna. We've got 4 drive-through sites that are open and then the respiratory clinic here at Graham Street. 2 of those sites are open until 8 o'clock tonight, so there's plenty of time. The wait times are in the order of about half an hour to an hour. So the 2 sites that are open tonight are at the Shepparton Sports Precinct and also at the Mooroopna Recreation Reserve. The other reason why it's really important in terms of why we want increased testing capacity is that we're using that data to not only understand and critically understand what's happening in relation to the outbreak and transmission chains amongst certain members of the community. The other reason why it's really important that we want people to come forward is that data and that information in relation to particular exposure sites, in particular the schools, is being used by our medical teams and the epidemiologists to actually understand what the transmission is among school communities. The reason why that's important is because potentially later today and into tomorrow, some of those school sites in particular that are classified as Tier 1 exposure sites may be able to be reversed to Tier 2 exposure sites. What that means is that a number of the household contacts who are not primary close contacts could then be released from home quarantine, which would then enable them to move back into the community and support the essential and critical services operations that we all are relying on at the moment to keep Shepparton and Mooroopna and the region moving. So if you haven't been tested, you've been to those exposure sites, please come forward and get tested straight away. Particularly for those people who have any symptoms, we're really keen to see you come forward to any of the locations that are available for testing. We're really fortunate to also have the support of the ADF. Today we've had around about 20 to 25 people now that have been through training programs, and they've already been deployed out this afternoon to some of the testing sites to boost and support that capacity. Later this afternoon there'll be additional ADF personnel arriving to help with that testing effort, and those folks will then be deployed again tomorrow. That ADF deployment is here for at least 1 to 2 weeks, if not longer, and that's going to be really important as we set our sights forward for the day 13 testing. So while we've got some immediate issues we're certainly concentrating on at the moment, looking forward there's a lot more work to be done, but we're planning for that day 13 testing and how we'll be able to progress that through as quickly as possible. In relation to GV Health's operations, we have over 500 staff that are now furloughed in relation to this outbreak. We don't have any staff that have tested positive. The reason why they're furloughed is simply because they've been to one of the exposure sites, or they've got children primarily because they've got children at the different school sites and they're required to be in home quarantine. All of our essential and critical services are still open and operating, such as our emergency department, our critical care unit, and a range of other services. We do have some pressure points in relation to that. We're working through that with the Department of Health, and we're grateful for the support of other health services across Victoria who have sent their staff to support our staff and make sure that the community has access to those critical and essential services. So I'm happy to take any questions now.
In terms of downgrading some of the exposure sites, when might that occur and which exposure sites we're talking?
So I'm not in a position to list or detail what the exposure sites are specifically, but our efforts are really concentrated on the school sites. We know that that's having the biggest impact for us in terms of as an employer, and talking to other people in the community, I know that that's exactly the same for them. So this morning we've already had one meeting on this particular issue with some really well qualified and experienced people that have managed similar circumstances in other outbreaks in Victoria in recent times. We've requested some more data analysis to be done this afternoon. That's happening right now, and we've got a further meeting this evening. So in the next 24 to 48 hours, I'm hopeful that we might be able to see some of those exposure sites have their tier rating reclassified, and which would be good news. But I should say, in relation to all of that work, first and foremost, our priority consideration in terms of that work is safety first. So we don't want to get into the situation where we would be releasing anyone from quarantine unless we're 100% confident and the public health team are 100% confident that that's the right thing to do.
Can you just run us through the total amount of cases at the moment?
So there is 67 active cases that are reported at the moment, but as I mentioned earlier, there has been a handful more of people testing positive this morning. So I expect that tomorrow's numbers will probably be higher, of course, than what's been reported at the moment.
How much is a handful?
It'll be at least 5 or 6 more, if not higher than that. It could well be higher than that. The results come in at various times during the course of the day, so that number could grow this afternoon and into this evening as well.
Is there a specific train of transmission or something that's seen a big jump in cases overnight?
So the chains of transmission are really linked to the family groups and other networks in the communities. At this stage, it doesn't appear there's too much happening across some of the schools, which is pleasing, and that's again while we're focusing our efforts on reviewing what's happening in the schools. There's also some transmission, some strong transmission in some retail sectors as well, which can sometimes be the case in these sorts of outbreaks.
Is that mainly among staff or among customers in those retail areas?
A mixture of both staff and customers in those areas.
How many people are currently isolating in Shepparton?
At the moment there's around about 4,500 primary close contacts. In terms of the total number of people who are isolating, it would be higher than that. I don't actually have that number available, but you know, based on what we're seeing, it would be several thousand.
Thanks, Matt.
Good.
Yeah, I do too. Yeah.
You can go. So we've heard it's 50 ADF working in testing sites and 20 actually visiting homes. Is that correct?
So yeah, those numbers are correct, and the 50 ADF personnel that are working with the testing sites are really closely linked with the coordination of the testing sites and the availability of services that GV Health is working on. In relation to the home and community engagement visits, that's something that the Department of Health is working through and leading that response, but I understand there's 10 to 20 ADF personnel working on that assignment.
So they're actually helping drop groceries and medicines and that sort of thing, some of the items that the community have been calling for, or are they not quite doing that yet?
That part of the deployment is not within the remit of what GV Health's doing. It might be best that perhaps Deb or Kim comment. on what's happening from a community relief. Our efforts are really focused on maintaining our essential hospital-based services and the public health contact tracing response.
With the ADF helping with testing, will they just be training today or actually working on the ground?
They're on the ground. So we've had two groups. A group that arrived on site early this morning that have been trained up, and they've already been deployed out to the Marupna Recreation Reserve. So their training has comprised some learning the systems, but then some practice of that in train. But they'll be fully independent later today, and there'll be another group that are going through that training this afternoon, and they'll be out on the sites tomorrow morning as well.
We've seen the testing sites across Shepparton be incredibly quiet in comparison to what we've seen in the lead up to this. Are you worried that some people still haven't been tested, or is it a matter of everyone who's been tested has been tested already and now they're just sort of sitting there, some of them?
No, I think our concern is that there are some people who should have come forward for testing that haven't done so yet, and that's why there's really two urgent calls we're making. That's anyone, of course, who's symptomatic with COVID-19, so the most mildest symptoms in particular, don't put it off, don't delay, come forward and be tested straight away. But also those people that have been to any of the exposure sites, we're really interested in getting those numbers of people through and increasing the percentages that are being tested, because that's going to give us the information that we need to understand what's happening with the outbreak, but also to understand what we might be able to do with some of the school classifications.
And sorry if you've already been asked this before, but what's holding people from coming back from getting tested?
I'm not sure why people wouldn't come forward to be tested. It's pretty straightforward things to do, and I would encourage people in terms of what the obligation is to support the community and do their little bit to come forward. I think sometimes earlier, say over the weekend where there was a lot of demand, I know that there was some queues for 3 or 4 hours, but that's not the case now. People can arrive for their test and be in and out of there within half an hour or up to an hour. It's really quite a quick turnaround time that we've got at the moment.
We've heard about positive cases in Merrigum. Are these included in Shep's numbers?
I believe they've been linked to the Shepparton outbreak, yes.
Yeah. Are there any other cases outside of the Shepparton area in regional Victoria that you're hearing about?
That work in terms of linking the other cases, nothing that's spread too widely or broadly that hasn't already been mentioned.
How many exposure sites are there at the moment?
There would be over 60 exposure sites now, and I think the best place people can access that information is the Department of Health's website, and you just need to search it by not only Shepparton but by other towns, such as you need to search for Marupna, of course, so it's a suburb by suburb, not so much a more broader area. So the coronavirus.vic.gov.au has all of that information plus others that's available.
So just back to those Merrigum cases that the ABC just mentioned, they're linked to Shepparton. Do you know what sort of numbers those Merrigum ones are?
No, not offhand.
No. Would they be included in those Shepparton numbers?
I understand, yeah, in terms of being linked to the outbreak, I understand that's the case.
And how many of the linked numbers are part of what's now the Royal Melbourne cluster, which is...
I don't have that information handy, Monique, sorry. Yeah.
Okay. And we've heard that there's some Navy medical officers being deployed to Shepparton to help with vaccinations. Is that true?
Not that I'm aware of, not in relation to our vaccination program. The ADF personnel are involved with testing and the home engagement program.
Is there any extra help coming for the vaccination centre or anything like that in Shepparton, or is it going okay at the moment?
We've managed to stabilise the service there, in the sense that we did have a number of people who have been furloughed that normally work in the vaccination program, but we've redeployed some of our own staff and some agency staff in there, and there's no issues with vaccination. And of course, we'd encourage everyone who hasn't been vaccinated so far to book in for an appointment as soon as possible.
In terms of the 500 furloughed healthcare staff, you mentioned before that healthcare staff are coming up from Melbourne. How many? Have you been given a figure about that?
So they're coming through, they're not coming through in big deployments like the ADF are in big numbers, but at this stage we would have at least 20 to 30 people from other health services that are across GV Health Services in helping us maintain that essential service to the community.
With today's numbers where they're at, where would you say we're at in the outbreak?
That's beyond my area of expertise. You really need to ask the public health physicians and the folks in the Department of Health that question.
Is there anyone in hospital in Shepparton with COVID-19?
Not at the moment, but we have had people being admitted and discharged home, but we've also unfortunately had to transfer some people to Melbourne who were not well.
How many have you transferred to Melbourne?
2.
When was that?
Monique, I'm not going to go into the specific details out of respect for those individual people.
Since the outbreak though?
Since this outbreak, yep, since Friday.
Yep.
Yep.
Do you happen to have any numbers on vaccinations in Shepparton since this outbreak at all?
So there's no issues with access to vaccination at our hub.
Yeah.
And we've done, I think it's well over 3,000 people since Friday have been vaccinated at our vaccination hub. We have extended opening hours for vaccination through to 8 p.m. So our vaccination hub is open until 8 p.m. every Tuesday, and we now are open on Saturdays from 8 a.m. to 4 p.m. There are plenty of appointments available. Obviously, with the widening of the eligibility for Pfizer, we would encourage all of those people who are now able to get a vaccine to get vaccinated as quickly as possible. Ultimately, that's the only thing really that's going to help the whole community and the whole country get on top of this in terms of stamping out this pandemic.
Good, everyone good? Okay. Are you pleased the ADF's arrived in town?
Yeah, look, I think we need to have that support, and they're also offering support door to door as coming up to the community members and giving them some essential support as well, which is great with some essential items.
Will you be asking the authorities to try and get them involved in restocking supermarket shelves or some of the logistics problems?
Yeah, look, there's lots of conversations at the moment in regard to what support is needed for our community. It's a very busy and challenging time, but the great thing is we've got essential support coming in. We've got some great organisations and committees really doing everything possible to support our community. So the main thing is that we stay calm and that we all work together and we try and work through the things that we need to. We are finding that, as we know, many people that are isolated are having difficulty getting their medications, their food. The essential items have to be our priority. So that's exactly what we're doing. We're prioritising those things, but making sure that people can get communicated to and connections to the things that they desperately need to be supported with.
How tough has it been watching your community? You guys have been crying out for help for a week. It hasn't just been a day, it's been 7 days of people struggling. And how tough has that been? And then what is it like to finally see that come through?
Yeah, look, every day is different. No one has had to manage something like this before, and we're all learning and we're trying the best we can. And I know we have needed extra support and we still need extra support. There's so many people that are needing support, and we know, as we had spoken about, that there's so many businesses that haven't got staff that can work because they are in isolation. So desperately need more support, and I think with emergency services coming in today that are giving us that guidance of how we manage this, that's what we're depending on at the moment.
Thank you.
Good afternoon, everyone. My name's Deb Abbott and I'm the Deputy Emergency Management Commissioner, and we're certainly here to assist the Greater Shepparton area. Firstly, I wanted to acknowledge the enormous work that has already gone on, and I think sometimes that it is lost when we have such great challenges ahead of us that we never stop working and we never actually stop trying to assist and support communities. We also know that this community is a very strong community, and I've been meeting with a range of people this morning, and that's what's come through so strongly, the enormous amount of effort and work that's already gone on, particularly in areas of relief. We have a large number of agencies and volunteer groups who are doing an enormous job at the moment, making sure that community is having access to those services, be it food and support. We also know that we've got some challenges ahead, so we do know we've got some challenges. We've also been speaking with food and grocery industry, and what they tell us is that Services such as online requests for food have gone up 300%. But they're adjusting and they're helping, as they always do, and making more online services available even now as we speak. You've heard about the ADF support that is in place for testing. From today we have ADF support that is helping us deliver food on the ground, and we'll be working very strongly with ADF over the coming days, making sure that again that we're servicing critical need and need where we have our most vulnerable or those that are really struggling with accessing services. As I said, I do also know that family and friends are providing that support to people that are isolated due to the various directions that are applying to them. What I can too say is that in our discussions with supermarkets, they tell us that we do have good supplies of food, the shelves are stocked, and that food is available. We do have workforce challenges, and that's where it is that we're trying to bolster through not only the ADF, but again, where it is we can link up with existing systems. We've been in emergencies before, and we know that those systems are good, tried and tested. We've been working more often than not with local council, as I said, those local agencies. They know their communities, they know them well, and they know what works. It's not for us to come in and say that doesn't work. We want to bolster, support and make sure that we're providing the guidance that adds greater value and make sure that those people in most need get what they need. Thank you.
Will you be asking the ADF to do more duties like getting groceries and items to residents?
As I said, from today we've already tasked ADF with supporting those services. Again, we know we've got a resilient community here, and some of this is new for people. They're finding out where it is that their networks can support them, and again I would encourage that. People are where they're well connected and they can get support from friends and neighbours to drop off food. Continue doing that, and in our discussions, as I said, with the supermarkets, that they're well prepared for being able to service that. They are open and they're ready to go.
With the supermarkets, there has been talk of it's taking quite a few days, those who are ringing up and trying to get a delivery. I have heard numbers of up to 5 days and things like that in the past few days to get anything delivered.
Yeah, as I said, supermarkets are and the whole food and grocery industry and chain are working with us, and we do work with them constantly. They are working with their online systems so to extend to other areas to make sure that it's supported outside of the Shepparton area to bolster and reduce some of those wait times. Again, it's not to say we don't have challenges ahead of us, because we know workforce is significantly affected, but if we work all together we can make a difference and we can get over this hump. It's an enormous challenge, and it's an enormous challenge not just for Shepparton but all of Victoria. It's not just going to be one area that faces these sort of challenges that Shepparton's facing now. We have to make sure we're prepared and we learn the lessons, and we make sure that we're ready to go whenever we have an outbreak, be it in rural regional Victoria or in the greater metro area.
What worries you most about the situation here and what you need to do in the next few days?
Where we'll be focusing our efforts, as I said, is to assist with making sure those well-tried and tested systems are being used to their greatest extent and being optimised, and making sure that where we do have gaps, because for all our best efforts we do know that people can slip through the gaps, and we have to make sure that we're doing our best effort to not only find out who they are but make sure they get what it is they need in order to get through this.
Shepparton's home to some of
of the biggest food producers and essential manufacturers like construction, they're reporting big staff losses. Will the ADF be helping in that so it doesn't affect the rest of the country?
We'll be working with the ADF to make sure that that deployment is the best use that it can be. But we also know that industry responds itself, so we don't want to duplicate what can be done by industry or community itself. And that's why working really closely with the ADF is so important, to make sure that we are placing those critical resources where it is we need them best.
Based on the need you've seen and heard of today, do you see that there might be more ADF personnel needed to help, stem the problem here?
Look, you can always need more and more resources. Again, we look at things from a state perspective and make sure that we're using those resources. And as we've seen here, you know, there's demand and priorities everywhere. But maximising those critical resources to the best way possible is really where our focus is and what it is we have to do. So we, as I said, working closely with people, making sure we understand what the local capability is, and as I said, the Greater Shepparton area is an extraordinarily capable and very, you know, good community that works together. We know that already. So as I said, we don't want to come in and make sure and disrupt any of that. We actually just want to bolster and support and make sure that we're making the connections, helping smooth the way where it is we can.
So how many, we've heard about the testing numbers, that number of ADF that are helping at testing sites. How many have you got doing these other helping in the community outside those testing site numbers?
At the moment, we're working with ADF to shore up exactly what is the best use of their deployed resources here. So we might be utilising ADF that are already visiting households to make sure that we get, again, the best engagement with community out of those resources. So I won't give you any specific numbers, because that really is for us to work with ADF to make sure that they advise us as well. They go, yes, we can do this, but we're not really good in that area. So we have to make sure that, as I said, we're not duplicating what is already actually done by what is an enormous volunteer workforce that's already supporting great relief needs already. The Greater Shepparton Council already doing an enormous job. We want to make sure that when we do deploy those resources, they're in the best possible position to optimise what it is we need on the ground. Thank you.